Welcome to Justice Talks. Today we're going to be talking about what is coping. My name is Dr. Lori Hall, and I'm joined by two guests. If you want to introduce yourselves.
Yes, I'm Cletus Bilali. I'm a PhD student here at USF in the Department of Crim, and I'm also a therapist.
And I'm Carrie Hopkins Hall, and I'm a visiting instructor here in the Department of Criminology.
Awesome. Thank you all so much for joining me. So we've kind of been talking a lot about coping and stress responses and survival strategies and kind of the ways that we manage our experiences, right? And we manage all of our experiences, whether it's trivial or traumatic, right? And so we do this through coping. And we've talked about coping a little bit, right? And so when we think about coping, we're talking about how we go about managing our experiences. And so there can be adaptive coping and there can be maladaptive coping. So can you think of, Carrie, like when we talk about adaptive coping, what are we talking about?
So adaptive coping might be like taking deep breaths, or if you're stressed in a moment or overwhelmed, or it could be like a lifestyle that has things that already try to decrease your stress, like exercise and eating well, having people that you talk to when you're struggling, those kind of things would be adaptive. It could be in the moment things, and then it could be kind of having that routine set up in a way that's healthy. And of course, ultimately counseling is a really great adaptive if you're going through something more where you need more help.
So like these are the things that we do that really support us and our mental health. Maybe they look differently for different people.
Of course.
I know that like for me, baking and cooking is kind of like therapeutic for me. It helps me to kind of make sense of things. I think about things. I'm also able to nurture myself and nurture other people. And some people, maybe they're exercise, they jog, they run, they walk.
Gardening, I think, is for a good amount of people, or yard work where you can kind of have an immediate cleaning too, right? Where you can have sort of an immediate effect, like a positive effect. You can see something good right there happen if you're feeling a little out of control, or there are things that are beyond your ability to change in your stress.
Okay. So why do you think though, like when I think about the word adaptive, like what is adaptive about it that, like helps us to cope, if that makes sense?
Yeah. So my first instinct is to go into what's maladaptive and compare it, but I'm trying to just think positively in terms of adaptive. I think it's adaptive in the sense of being able to make it fit, right? Make it work, but it's a positive. So it's not increasing your stress. It's not making it worse in the long run, which is what we'll talk about when we get to maladaptive. So you're adapting, but sometimes when we adapt in a way that's not positive.
So I could think of it maybe like as it's able to like effortlessly move into our lifestyle.
Right. So you're not going to have any negative consequences. It's not going to create problems, right? So if I go and exercise in the morning, I'm not creating social issues or other issues that might meet the definition of maladaptive.
So then how is this different from maladaptive?
So I think a lot about maladaptive, not that all maladaptive coping is addictive, but often we see that maladaptive coping meets criteria or fits closely with addictive behaviors, substance use, but also gambling or, sex or porn or
video games.
I think about like exercising too. I think that behaviors that we use to cope, right, can be either adaptive or maladaptive. And I think it's contextualized in what you're saying, like that they can become addictive, right? So when we start to do these things repetitively against kind of like our good benefits, right? Like we're exercising even though we're hurting and we don't really necessarily want to be doing this, but there's something that's saying if you don't do this, then something will happen.
Right. And I think there's a level of like it being like automatic. So like I'll see like say my partner, if we're like something stressful's happening, he'll pick up his phone and sort of like be, and it's not a conscious, like, I want to look this thing up on my phone or, oh, you know, there's these funny videos I like. It's like I don't know what to do.
Yeah.
You know, and that for me mentally is sort of what I think of with maladaptive coping. Like you mentioned gaming or a computer. That's a huge one, right? Especially for everybody, but especially like younger people. Well, I'm gonna play this game, and it's more of a distraction. I think that's a good distinction because you said when you're cooking or baking, you're thinking things through, right? You're maybe putting things in perspective or processing or problem solving.
It's the result that caused the problem. The having to eat it all.
But like if I'm numbing, if the behavior is somewhat numbing, I think that's a really good sign that
So
it's
like checking out, like you're avoiding it.
Yep.
Okay.
Because we know that in that the coping strategies world, there's approach and avoidant coping. And you can also kind of put that in those same categories. It's approach coping and adaptive coping if I go see you as a therapist because I'm struggling, or if I ask friends for help, or if I...
So you're approaching the situation.
Yes.
You're confronting it rather than avoiding it.
Exactly.
Okay.
So same with exercise, right? It's a good example. I know I exercise pretty much every day, and I have to think of what you're saying. Like, it's a mental health, it's a physical health, it's a me time. But if I'm hurt and I'm still doing it, am I going into like a maladaptive? Do I depend too much on that in an unhealthy
What
way?
if you lose sleep to do it?
I mean, I think a lot of you just mentioned consequences, right? I was thinking about this on the way here, how a lot of it is you almost have to reverse engineer it, which makes it hard. So like, let's use drinking. So if you are a college student and you go have a few drinks with your friends, you have a good time, nothing bad happens, it's probably fine. If you are a college student and you continuously go out to drink with your friends and you start not getting sleep, you start missing classes, you start getting having instructors say, hey, you're missing classes or you're missing assignments. So it's like...
See, when I think about using substances, and I use that term broadly, I think that we've talked about this before, right? Substances is anything that we're using to cope, right? So that can be doom scrolling, that can be video games, that can be gambling, porn, that can be drugs, that can be alcohol, that could be food, whatever it is, right? So any substance. But when I think about if we're using it to cope with things in an avoidant way, like we don't want to, right? I find it problematic. But the one area that I struggle with the most is when we start to talk about like drugs and alcohol, because my view is like, one, any use is avoidance.
And I think we have to be careful with that, because I definitely understand why you would look at it that way. And I think there are people who do, but in our society as it is, having a drink with socially is not necessarily avoidant behavior. It may be, but it's not. If you're like an abstinence-based person who just thinks, you know, using substances is avoidant in and of itself, then that's how you would see it.
But I would question, like in that situation, like you're meeting a friend at a restaurant, whatever, and you have a glass of wine. I would still feel like that was avoidance, because there is some kind of tension or anxiety in that situation that you are using that substance to manage.
That's always possible, and that's what makes it tricky. But I would hesitate to make a blanket statement from my perspective, because I've seen people who have what I consider a pretty healthy relationship with alcohol, or even, you know, I'm not a big fan of marijuana, but there are people who use it in a way that doesn't have consequences.
But like, what if we're talking like, you know, you are hanging out with people and like you snort a line of cocaine? Like, is that ever approach or avoidant, or is that nothing?
Right. It gets into, I guess it gets into, are we talking about coping? Or are we talking about addictive behavior? Are we, there's a lot of different lines. I mean, and some of it's what society has decided is somewhat okay or not. But I think I would look at like, doing a line of coke as pretty severe.
Yeah, that's where I struggle because like, like when I think about substances, like in the way that I think about their use, right? A lot of that, or almost all of it, I would say, is contextualized in coping, right?
Right.
But there's a lot of people that are like, no, it's not coping. Like I'm just having fun, or I'm hanging out with friends, or people are doing, and like I just can't seem to find that like logic in that argument.
I think you just like helped me to understand it in a way that maybe I can clarify, and I would love to hear if you agree. Like, there's a huge segment of population who's dealing with trauma. They're dealing with overwhelming stress, poverty, socioeconomic issues, loneliness, whatever, where that's what it is. It's a coping. But there is a segment of population, in my opinion, that is not using it for coping. And there's that line. But we see, I know in my life, I've seen so many of the ones that are doing it as a coping skill that it's easy to get like, just no, it's not a good thing.
I would still argue though, like I understand what you're saying. Yeah. Like I do think that there are absolutely people that are like, I'm fine. Everything is fine. Like I don't have any whatever. Yeah. But I would still push back to those people and say like, I do think that there's underlying things that you're not really maybe approaching or ready to confront. And you use these to avoid something. Right. Cause for my entire life, I would not have thought that I had a problem with food addiction, right? I would have been like, I'm fine. Like it just, being overweight runs in my family. Like I wouldn't have even thought about it. And it wasn't until I had an experience where, like someone triggered me so badly. And then it was so clear to me that I wanted to get food that I was like, oh, this is what I've been fighting, right? And I still struggle with that every single day, recognizing like when I'm eating because I need to and when I'm eating because there's a void.
And that's a particularly tricky one. Yeah. Because you can live your whole life without alcohol or drugs. Many people do. And many people who have addiction issues then stop and never have it again. Can't do that with food.
Yeah.
Right.
That's so hard.
You can't do that with, if we look at like codependency, like relationships, right? Where you want to have connecting, meaningful relationships. So you don't want to not have that. Sex is usually a healthy part of life. Those are not a thing you want to necessarily give up for the rest of your life. But if you have that unhealthy relationship with it,
it can become dysfunctional. And I see it all the time with sleep too, particularly with patients who are dealing with depression or any type of mental health disorder. But a lot of my patients, when we have the conversation about, well, how are you dealing with, with this episode, they say, well, I've just been so tired. So I've been trying to give my body as much rest as possible. And lo and behold, we find out they're sleeping for like 20 hours a day. Right. Yeah. And so it's getting this is kind of part of why it's so difficult to kind of establish, like, at which point does a coping skill become maladaptive, right? Even if it starts out as like, this works in the moment, this is helping me address this immediate issue, is it sustainable? And if the answer to that is no, if it's going to lead to harm to you or to somebody else, even if it's prolonged, right, you have to really take a step back and think, okay, I need to develop some better coping skills, some better self-care skills. Otherwise it will get very dark very quickly.
That's a perfect example. And I appreciate that, because that's the thing. Like, I think you're probably looking for like a more straightforward answer than we'll be able to get, because it is like, oh, good, I'm getting sleep, I'm taking care of myself. Some people struggle with sleep, and then you delve into it more and you're like, that is too much sleep. And that is clearly a depressive symptom. Which you could say with, like, I go back to the exercise. If you feel like guilty because you skipped a day of exercise, for example, like that probably means you're in some of that maladaptive coping area where you're like upset, or some obsessive kind of area where you can't just be like, this is a good thing I do for myself. And today it didn't work out, right? When you start to like maybe shame yourself for not doing it or something of that nature. But
okay. That got real.
Well, I was talking about me, but I know you can relate too.
I was like, dang, that hard.
But I think you have to be careful because like if you're not someone who drinks, or we'll just keep it at drinking since that's legal and, socially acceptable, then it would be easy to look at everyone who's drinking as like, they're all just avoidant coping. And maybe 90% of them are, we don't know. But I've certainly seen more addiction in my life than I would have liked to, both personally and professionally. But there are people who I can put it this way, it doesn't create a negative consequence in their life that we can see.
So, but do you think that that's like the threshold that we have to say something is maladaptive? That it causes a negative, because I think about, there's a lot of instances where it's like, it doesn't necessarily create a negative consequence in their life. Like I'm thinking, I don't know, like I might be wrong about this, but I'm thinking about like Michael Jackson.
Okay.
Like he was using propofol as like a sleep aid, and like he's successful. He's wealthy. Like he has relationships with people. Like we didn't really hear any of that breaking down, right? I know that we don't know the backside.
No, but that's not what I was going to say. What I was going to say is that's the problem of enabling. When people enable people's behavior so that there isn't a negative consequence, that doesn't mean it wasn't maladaptive coping.
Okay.
See what I mean?
So now,
so like say you're my partner and you're drinking every day and I say, you know what? Let's have you stay home. Don't drive to work every day because I think it's better if you just stay home. So I'm doing that not because I think it's better if you stay home, but because I don't want you to get a DUI or something of that, or I don't want you to hurt someone. That can seem loving, but it's very much taking you away from even the possibility of a consequence.
Okay. So then I have another question. If enabling creates conditions where we cannot necessarily see whether it's maladaptive or not, are we as a society not enabling people by excusing or allowing or accepting alcohol and drug use to degrees?
Yeah, I think that's not an unfair observation. I think that's a fair way to look at it to some extent.
So really, if we were to say alcohol use at any use is unacceptable, substance use, drug use in any capacity is unacceptable, we would then see like we did during Prohibition.
I was just going to say, right.
Right.
So you see there are people who just walk away from it, right? Well, okay. Well, it's not legal anymore, so I'm not interested. And you see people who are like, well, then I'm making it in my basement, even if that means I'm going to go blind. Right. Yeah. No, I think it's a good point. Yeah. I think it's a hard experiment at this point because like our kids were born into a society where drinking is not only accepted but glorified. Like, oh, you're gonna have the best time when you do, so it's hard to parse out how much of it is like okay and how much of it is they're being pushed towards that. They're being, it's a product obviously that makes a lot of money for us, because that's why we stopped Prohibition, was the financials essentially. Like
I don't know. I think this is just like a challenging thing because I think that like in the recovery space, right, we don't want to enable people. We want people to approach and we want people to cope in healthy, adaptive ways, right?
Absolutely.
But yet so much of like even what we're talking about has been like engineered in a way that we enable at all costs. We enable around every corner, on every sign and every advertisement. We're doing everything to enable. Like, you mentioned like children are just born into this generation or whatever, but like I didn't like give into Like, this is just our culture or whatever. Like,
Mhm.
in terms of like with parenting of my children, like my children actually like are disgusted by like people even just casual drinking, right?
Mhm.
They're like, what is the absolute point? What are you running from? Why do you need, like, why not have a conversation with your therapist? Like, I don't understand. And like, I'm at the place too. Like, I don't understand why, as a society, we want to offer that as a coping mechanism,
Mhm.
right? When like, I already struggle with exercise as, some days it might be adaptive, some days it may be
Totally.
maladaptive.
Yeah.
Food is the same way. Baking can be the same way because there
Mhm.
are times where I go through periods in my life where I'm like, I need more nurturing. And so then I
Mhm.
bake, and then it's like, well, I baked all of this, so let me eat this. And then,
Yep.
well, like, now I feel bad because I ate this. So now, like, I need to go and exercise. And then if I
Mhm.
don't exercise, like, it's just this spiral. Like, there's already so much, but yet, like, I think that the problem that we get into is like, there's not a clear understanding, right?
There's not a clear understanding
Mhm.
and there's not a clear line.
Yeah.
Because the other thing you could talk about is things like harm reduction, right?
Mhm.
And
Mhm.
like you were talking about the recovery space. Well, I know a lot of people who don't use IV drugs anymore, for
Mhm.
example.
Yeah.
Thank goodness.
Mhm.
But they smoke cigarettes
Yeah.
Mhm.
because it's a lesser of evils, so to
Yeah.
speak, and it helps
Mhm.
them to not go back to their drug of choice.
Mhm.
I don't like that, but I'm not going to hold them to a standard that
Mhm.
is unreasonable or not meeting them where they are, that
Mhm.
maybe sometime they'll get past that. But
Yeah.
Mhm.
and in some circles, being on mental health medication when you're in recovery is
Mhm.
looked down upon. I don't know if you've
Mhm.
seen that in your
Yep.
experience, but which is really dangerous in my
Mhm.
opinion,
Yeah.
to if someone has, let's say they were having anxiety and that maybe was part of the impetus for them to use drugs or alcohol, and they get clean and that anxiety pops up probably twice as
Mhm.
bad, and they want to go to someone and get a medically prescribed, anti-anxiety, but in some of the recovery spaces that's perceived as, well, you're just trading drugs.
Yeah.
Mhm.
Okay. So I th- I think that it's still such like a gray area. It's
Mhm.
so challenging and difficult, but I think I want to try to like sum it up for those watching. So when we're talking about coping, we're talking about whether or not we're approaching or avoiding, right?
Mhm.
And when we talk about approach coping, we're talking about the ways that we are trying to manage feelings, thoughts, experiences
Mhm.
in a way that is adaptive, that
Mhm.
it seamlessly kind of fits into our life versus avoiding whatever it is, trying to numb whatever it is, and using things to assist us in that. And that's when it becomes maladaptive. And there's not really like a list.
Mhm.
And I would just add one thing, which is, in general, I think we have a really hard time as a culture just sitting with discomfort,
Mhm.
sitting with uncomfortable feelings. So maybe you're right. Maybe that's why people go out and get a drink. If people can't sit with
Mhm.
grief or rejection or stress or whatever's coming up, that's something I think that's really worth looking at in yourself.
Mhm. Yeah.
Because we just don't, our brain runs from any kind of pain.
Yeah.
Mhm.
And so if you can sit and be like, I'm okay.
Mhm.
I don't like
Yeah.
how this feels, but I'm safe. I'm okay right now, rather than immediately getting on the phone or getting a drink or doing whatever. I
Yeah.
think that's a good
Mhm.
way to, good thing to keep in mind.
Yeah.
Mhm.
Okay. Well, thank y'all so much. I've enjoyed it greatly. And you're watching Justice Talks. We'll see you next time.